Hi, I'm Kirk Taylor, and I'm an occupational therapist at the University of Nova, and I'm here to enter a room where my patient is 57 years old, and he had a recent brain injury, and I'm just going to introduce myself to the room. His wife is present at the bedside, so I'm going to perform an assessment on Mr. Taylor here. Okay. Hi, how are you?
Good, how are you?
I'm all right. I'm here. I'm Kirk Taylor. I'm here to assess your husband.
Yes.
He had this brain injury, so I'm here to find out his level of consciousness. I'm going to do the Glasgow Coma scale on him today.
Good.
Okay. All right. I noticed that he's not opening his eyes. I'm in the room and he's not opening his eyes, so he's not reacting spontaneously. So I'm going to see if he'll respond to sound. Mr. Taylor. Okay. He's not responding to sound, so I'm going to see if he's going to react to pain, to pressure. Let's see. I'm going to apply pressure here, but not too much, but just enough to have him react. Okay, so he opened his eyes. Okay, so for this instant, he is responding to pressure. So he has a I score of 2. I should have said that for the Glasgow Coma scale, there are 3 different sections. We're going to be testing his eye movements, his verbal movement, his verbal capabilities, and his motor capabilities. So you can get a maximum score for the eyes of 4, maximum score for verbal of 5, for motor of 6. So giving you a total max score of 15. But the minimum that can be had from a patient is 3. So far his score for the eye test that I just did is a 2. So for the verbal part, I'm going to ask him a couple of questions. Let me try to open his eyes again, see if we can get his eyes to open so I can ask him. Mr. Taylor, okay, what is your name? Where are you?
I don't know.
Okay, so he is confused. So he's gonna get a score of 4 because he's at a confused level. If he were if he was oriented, he would receive a full score of 5. If he had said some words that were inappropriate, then he would have gotten a score of 3. If it was like incomprehensible what he was saying, like he was saying ER or whatever, was just gibberish mainly, he would have gotten a score of 4. No, 5, 4, 3, 2. 2 of scores 2. Sorry, but in this case he's confused, so he's going to get a score of 4. So the next test I'm going to do on him, Mrs. Taylor, I'm going to see if I can do a motor test on him. So for the motor test part, I have to do a basically 2-step, like a 2-step motor movement. Either he's going to grasp my finger, or he is going to, I'm going to try and see if he can stick out his tongue or something. I don't think he's going to be able to grasp my finger. And Mr. Taylor, can you stick out your tongue? Okay. He is reacting to localizing stimulus. I applied my hand at the trapezius area, and he is reacting to the stimulus. He has reacted to obeying commands. If he had reacted to obeying commands, it would have been a 6. That's a peripheral stimulus of obeying commands when I stick out his tongue or hold my fingers. But instead, he would try to do a centralized test. When I touch his trapezius, for even less than 10 seconds, he is reacting to the trapezius. If he did react to the trapezius pinch, I would have held his eyes here to see if he reacted to that for 10 seconds. If he had reacted to that and localized that, then it would also, you'd also get a 5. So for this instance, for his motor movements, he has gotten a 5 for that. So going back to the eyes section now, if his eyes were, for instance, swollen shut, it would have been non-testable, so he would have gotten a no testing. Or if he was in a situation where he was not even reacting to the pressure and putting on his finger, then he would have received a score of 1. That would be a non-score. So it's either a non-score, or if his eyes were swollen and there's no point in doing the test, it would be a non-testable exercise. The same for verbal. If he had a tube down his throat and he couldn't respond, it would be a non-testable situation there also. Or if there's no tube at his throat or no obstruction of anything with his verbal skills, then he would have received a low score of a 1 there. That would be an end score of none. For the motor movements, there too, there's some other differences or scores that he could get at the motor movement level, and I'll go into that a little later in another part of this video. But I just want to end the video saying that he, with his I score of 2, his verbal score of 4, so that's 4 and 4, 5, 6, and his motor score of 5, he receives a total of 11 out of 15, so he's not so bad. I'm going to go into it further in another part of the thing. As I said before, his max score is 15 and his mean score is 3. Okay, so that basically concludes his assessment of his Glasgow assessment. I don't remember if I did mention that the Glasgow assessment was done by Graham Teasdale and Brian Jennett in 1974 for brain injury patients or patients who they are monitoring in ICU. Thank you very much. Okay, I just wanted to indicate or expand on the motor section of the Glasgow Coma scale. There are 3 different parts I just wanted to expand upon. And I wanted to demonstrate, this is, again, aside from the assessment that I did before on Mr. Taylor. This is just to show the 3 other steps that I wasn't able to put in the assessment for Mr. Taylor. So I'm going to demonstrate with Mr. Taylor the withdrawal part of the motor test. So I'm going to apply that trapezius pinch on Mr. Taylor. And there it is. It's a quick reflex, a normal reflex action, and he is moving his head away from the stimulus. Okay, the next one is abnormal flexion. So I'm going to again apply the trapezius pinch to Mr. Taylor to demonstrate abnormal flexion. So you see it's a slow movement towards the pain, and his body, his hand is all flexed and just extended. So this is an abnormal flexion. Okay, and the last one in the motor exercise is the abnormal extension. So I'm going to ask Mr. Taylor to demonstrate abnormal extension when I apply the trapezius pinch. Okay? And that's a very bad sign. And for this abnormal extension, he'd receive a score of 2. And it's also called the decelerate, it's a decelerate form. And that's about it for it. One more thing I should add is that if the patient is paralyzed completely, you just are making your notes that it's non-testable. It's a paralysis and it can't be tested. Thank you.